Thanks to all of you who are joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin in a moment. As usual, after he makes brief remarks, Dr. Garza will address questions that have been submitted by members of the media. Reporters who have questions during the briefing can submit those to the Task Force Public Information contacts. We will address those during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, good afternoon, and thank you for your time as we talk about where we stand on the COVID pandemic entering into this holiday weekend. I wanted to take a couple of minutes to reflect on conversations that I've been fortunate enough to have with some of our frontline healthcare workers today as I was out and about. And what I saw and heard was truly inspiring. Although many of them have settled in on the new normal, there's still anxiety about personal protective equipment, and we've talked about that quite frequently in the past. But however, one of the things that was a bit surprising to me is I was told that people are now requesting to work on dedicated COVID units. And so when I asked the staff why they were wanting to work on a COVID unit, they told me a lot of different things which were quite inspiring. Some of them said, this is what we do, and this is what I went into healthcare for, and this is where I'm needed the most. Others said things like, well, we want to limit the exposure to some of our fellow healthcare workers so that they don't have to take the risk of being exposed to COVID. One nurse talked about how in their 30 years of nursing, they had never experienced such camaraderie or esprit de corps in their unit. And lastly, my favorite was, we're going to kick this virus's butt. So I want to thank you so much for all of the frontline staff that allowed me to come and talk with them today. It was a really inspiring experience. I also want to share with you a couple of other announcements. We've been working to strengthen our lines of communication with our emergency operations centers across the metro area. And so I'm pleased that as of today, we have a liaison officer who's working with us that is working with 5 Missouri emergency operations centers from representing Franklin County, Jefferson County, St. Charles County, St. Louis County, and St. Louis City. And this gentleman will be working alongside our task force. For many of us, I'm going to switch gears a little bit now, and you'll notice I'm wearing some AirPods, and it'll become apparent here in a minute. This is an incredibly stressful and sad time. So before I update the numbers with you that we've been sharing every day, we wanted you to hear from a mental health expert about the impact of this situation. And as you know, mental health is a critical component of the public health picture, and we have to focus on attention to this as we work our way through this crisis. So I'm really happy to introduce one of the area's leading experts on mental health, and this is Dr. Timothy Bono. Dr. Bono is a psychology professor at Washington University in St. Louis, and he joins us now remotely to share an overview on strategies and tips to address psychological well-being during this difficult time. So Dr. Bono, thank you so much for sharing your thoughts with us.
It's my pleasure to join you today, Dr. Garza. As you mentioned, this is an incredibly challenging time for all of us right now. And so in the interest of maintaining our mental health right now, I'd like to share with you 3 behaviors and 2 mindsets that I believe can be helpful for us in the current situation that we're in. The first of those behaviors has to do with restoring a sense of autonomy. Part of what makes this situation so challenging is that it can very easily feel like things are spiraling out of control. And so it becomes very important then to maintain focus on those things that are still within our control. Things like getting exercise on a regular basis, or cooking our favorite meals, or watching our favorite TV shows, or expressing gratitude for those things that are still going well in our personal lives and in our communities. The second of those behaviors has to do with working toward goals each day that help us feel a sense of competence and a sense of accomplishment. And even though the current set of circumstances can make it difficult to do that, it's okay to focus even on those behaviors that are small in nature. Even things like starting our day by cooking a good, healthy breakfast, or taking a walk around the neighborhood, or even something as simple as making our bed each morning. Because the sense of satisfaction that comes from accomplishing even a small goal can motivate us to accomplish larger goals later in the day. And that sense of accomplishment can be very important for our overall psychological health. And the third behavior, which is arguably the most important, is finding a sense of relatedness. Because we know that maintaining connections with friends and family members, even if that's through video chat or virtual happy hours or a good old fashioned phone call, that really is one of the most important ways to maintain psychological health, really at any time, but especially during a crisis. So, in addition to those three behaviors, there are also two mindsets that I believe are very important as well. And the first of those is to give yourself permission to be human, which is to say, allow yourself to feel whatever it is that you are feeling. It's natural to experience sadness or anxiety or other forms of psychological distress at a time like this. Inevitably, there will be days where we're not able to make as much progress toward our goals as we had hoped. And that's okay. On those kinds of days, it's important to practice self-compassion. Go easy on yourself. And then when you can, turn attention back to making progress toward those goals in those areas that are realistic for you. And the other mindset that's important here is to take things one day at a time. Because ultimately, we know that one of the major drivers of anxiety has to do with uncertainty about the future, about what the economy is going to look like, about what our jobs are going to look like, and about what our health is going to look like. And certainly it's important to be thinking about those things and planning for them, but it's also important not to get too far ahead of ourselves and to be taking things one day at a time and asking ourselves, what do those things look like today? What can I be doing today? And what can I be doing to work as hard as I can on those things based on the information that I currently have available to me? So incorporating those three behaviors, finding opportunities that promote autonomy, competence, and relatedness, and then giving ourselves permission to be human, taking things one day at a time, I believe that approach can position us for a sense of well-being, even amid these very challenging times that we are all in. And with that, Dr. Garza, I will hand things back over to you.
Great. Thank you, Dr. Bonner. Really appreciate your time with us today. So we're going to now and move over to some of the numbers that we've been sharing with you over the course of the past 7 days or so. So again, these data are the combined figures from our 4 major healthcare systems that are part of the task force. So as you can see, hospitalizations are down from yesterday, from 611 to 584 today. The number of patients in our intensive care units is down slightly, from 219 yesterday to 205 today. And the number of patients now on ventilators is also down, from 173 people yesterday now down to 160. Across the health care systems, we've had 36 COVID-19 patients that were discharged yesterday. Now, those numbers are down a little bit over the past 24 hours, but as you've heard me say repeatedly, we don't track those numbers significantly from day to day. We're looking at long-term trends. And you've heard me say repeatedly that we're still on the upslope of the curve, and we have to be very mindful that we know that the surge in patients is going to be coming in the next couple of weeks. So again, we need to do everything that we can to limit the amount of exposure, to limit the spread, limit infections, so allow those healthcare workers that I spoke about previously to do the jobs that they are meant to do. On the capacity question, and I know there's a lot of interest in capacity in the healthcare systems, and I've been sharing a lot of numbers this week. So as of today, those numbers that we've shared, we're able to handle. We're handling it okay with the capacity that we have. We're going to continue, though, to urge everybody to do their part to keep those numbers low. And we're going to be working, as well as a team here, to get a little bit better understanding on the capacity numbers so we can give a little bit more clear idea on how we're performing. And lastly, I know this is a holiday weekend, and I know it's generally a time when families and friends come together. However, this virus doesn't celebrate holidays, unfortunately. So as tempting as it is to invite family and friends over for large gatherings, I would just ask all of us to take that personal sacrifice this year for the greater good of the community. Let's keep practicing that social distancing, keep practicing our hand hygiene, washing hands, washing surfaces, and this will all pay off in the long run. And with that, I'm happy to address some of those questions that we've received from the media.
Dr. Garza, how is zip code and racial data collected? Are hospitals reporting the information to counties, or are patients required to submit it themselves to the county?
So as far as patient data submitted to the county, so there's a couple of different ways that we look at this. So one is the CDC form, which is called the Patient Under Investigation, or the PUI form, where some of that data is captured, which is then sent to the CDC and the health departments. And so they do get data that way. The second way that we look at it is we're beginning to collect data from the hospital level, which we routinely do just to look at our demographics and things like that. So we have built a system where we can pool the population of COVID patients at the patient level, so then we can start doing that analysis as well on race, ethnicity, zip code, all of those other things, so we get a better picture on who is at risk and what is the population of patients that we're treating.
Dr. Garza, it's been more than a month since the first St. Louis resident tested positive for COVID-19. Can you tell us whether that patient has recovered?
I cannot tell you specifically whether that patient has recovered, and you border up a little bit on HIPAA laws, and so we've got to be really careful about how specific we get in identifying individual patients. So no, I don't have information on that.
How long do COVID-19 symptoms last? Is it comparable to the flu?
So it's different for every patient, right? And so as I've mentioned before, some people are completely asymptomatic, and so you can go from asymptomatic to being very sick. Now it's a viral illness, respiratory viral illness, so it typically lasts anywhere from around 10 days to 2 weeks. Typically when we're asking patients to self-quarantine, we tell them to self-quarantine if they have exposure or something like that for up to 14 days, because we think that's the optimal amount of time that all of the symptoms would have passed, and they wouldn't be exposing anybody to virus after that.
And for COVID-19 patients who are hospitalized, are they tested again and then sent home after testing comes back? Do you have the capacity to do that kind of retesting if it is required?
Good question. So we do not test patients when they're being discharged, and part of that is some of the testing conservation, but we typically go by clinical criteria. So that's what we use. And so the typical course is 7 days since onset of symptoms, and then 48 hours of no fever, and then patients are able to be discharged home with the instructions that they should wear a mask up to 14 days since the onset of symptoms. So again, going back to that 14 days timeline. And so that's typically the discharge instructions that we use. Nursing home patients are a little bit different. We want to extend that time out to be 72 hours for them to be without a fever. But for most patients, it's around 48 hours. And there's a good reason for that. You can still test positive without shedding any virus. And so you don't want to use that to be the primary indicator for discharge when the patient really is not at a risk to other people and could go home.
Thank you, Dr. Garza. That concludes the questions that have been received by the Task Force Public Information contacts prior to and during this live stream. If members of the media have additional questions for the task force, They can submit those via email to the task force public information contacts, and we'll address them throughout the course of the afternoon. Beginning tomorrow morning, we will be accepting questions via email for tomorrow afternoon's live stream. This concludes today's briefing by the St. Louis Metropolitan Pandemic Task Force. Thank you for tuning in.